Missing teeth affect much more than appearance. When a tooth is lost and not replaced, the jawbone in that area can slowly begin to shrink because it no longer receives stimulation from the tooth root during chewing. Over time, nearby teeth may begin shifting into the empty space, which can change your bite and place extra pressure on other teeth. Some patients also notice difficulty chewing, speech changes, or increased wear on remaining teeth. As bone loss progresses, the face can gradually lose support, creating a more aged or sunken appearance around the mouth and jawline. The good news is that several treatment options are available to replace missing teeth, including dental implants, bridges, implant-supported restorations, and full mouth solutions such as all-on-4 dental implants. Early treatment can often help preserve bone and reduce the need for more complex procedures later. A consultation and CT scan can help determine which options may work best for your situation. If you are missing teeth and would like to learn more about your treatment options, contact our team to schedule an evaluation.